Welcome, everybody. I would like to introduce Dr. Hariharan from Pondicherry in India. Dr. Hariharan is an international music therapist, an music educator, and a sound healer. He's written more than 40 books, 50 research papers. You probably continue to add to this list.
Thank you. And I shall try to share whatever is possible within a short span of time. And we will add up more when we meet one-to-one in Sydney very soon.
How old were you when you got first introduced to the power of music?
I was 7 when I was introduced to the tradition of music learning, and with my mother, and who is still living at the age of 87, and she has been an inspiration throughout my life in all parts of my life situation.
What do you love about your field? What made you continue pursuing your music therapy in such depth?
Yeah, there is a two stories. One is the real story when my mother was born as a premature baby in 6 months. She was born in 6 months, and when she was born, my grandfather, who is basically an engineer but a passionate astrologer, looking at her chart at the age of 6 months, premature baby, not even 9 months, 6 months, he predicted that she will be a musician from her astrological chart. It came true, not because of predictions, because of the chart's combination. She is today 87, having succeeded in many ways of a musical living. And I thought because of musical healing and innate musical culture in her body that she has come up in her life. She has lived today because of music.
Some people may know nothing about music therapy. Maybe you can explain a little bit, what is music therapy?
You can heal people both mentally and physically with music. Physically, in the sense, people having diagnosed ailments like blood pressures, pain, or depression, they are basically organic. See, what we are working is purely tones or sounds, and which gets into the body slowly, and they get adjusted the sound, whether it is new or old or unknown or known sounds, and it works on the people slowly. That's number one. And number two, all my music is purely non-textual, or it is only sounds, that is instrumental. I do not use vocal music for healing. But the supplementary for music healing is sacred sounds and chants and mantras. They are purely textual, which is supplementary to the main music therapy.
What do you think are the biggest benefits of music therapy? When is music therapy maybe recommended over some other treatments?
I have got 26 types of music CDs, 26 varieties of music CDs, covering all types of people, to start with children, then disabled children or challenged children, then women, then we have got senior citizens, old senior citizen, people with Alzheimer's and Parkinson's and dementia. It works very well with those kind of people, and people having above 50s and 60s, people having diabetes, blood pressure and depression and anxiety. It is taking toll with everybody in way of life. And finally, 2 levels of cancer. Today there are more than 60 types of cancers which doctors have identified, and the music therapy works with 2 levels of cancer or cancer management. So music therapy gets in all types of people. You cannot listen to the music when you are doing all other types of work, like chatting, cooking, eating, drinking, walking. No, it has been listened to when you go to bed. It is
Right.
very,
Okay. You
very
need to be fully focused.
fully focused when it is on a sleeping mode. So when you go for your sleep or bed, start your music therapy and slowly it gets into your body by the time you wake up. And this process takes about 6 months. It depends upon individual, but minimum 6 months. And you have a 80% of healing success with this music therapy. My music therapy is a combination of instrumental music, then the mantras or the sacred chants, and finally astrological foundation. I do astrological foundation not for prediction, but for a diagnosis.
Can you tell our listeners a little bit about the concert and also the kirtan session?
Yeah,
So we have
yeah,
a concert on the 4th of May from 6:30 to 7:30, and what we'll be listening to and
yeah,
reflecting on that
yeah.
day.
That's it. See here, if you look at the American or Western music therapy, the I should not call the patients or the people who are have difficulties do not participate. They just listen to the music by the music therapist. Here, people participate and experience the music within. So it's a kind of preparation for them to get their body ready for the music therapy sessions. So when they do the kirtan, they participate and they sing, and their bodies completely become very flexible or totally away from all other diversions. So their mind is focused now. Then I do the kirtan, then I do the healing, chakra healing music concert, where I open all the chakras of the people, 6 chakras, through the concert. Each chakra is opened up. They listen to the music, special music that I sing, then the chakra is closed. So all the 6 chakras are opened and closed and positioned, and then their body is completely fit for the music therapy sessions. And some people sign up for one-to-one sessions where I give them the remedial measures for the next 6 months, looking at their chart and other difficulties that we discussed.
Great. And I remember you mentioned that anybody who does a one-on-one session with you is able to communicate with you for that 6 months period if
One,
they need to.
1 year, make a
One
correction,
year.
1 year, yeah,
Okay.
1 year. And they can record the sessions during the 1 hour because during the discussion they may miss something, they may not understand. So they can record the whole session and go back home and replay. And what I need for the one-to-one session is only the date and time of place of birth, nothing else.
Fantastic. Looking forward to welcoming you to the studio and welcoming
Thank
you
you.
to Australia.
Thank you. Thank you
And thank
so
you very much for the interview
Thank,
today.
thank you so. Thank you. See you all of you both, and visit me soon. Thank you so much.